getting late period, can it cause infertility? So now let us first see why you can get late periods. So duration of a normal menstrual cycle is considered between 28 to 35 days. Anything which is beyond 35 days is considered late cycles or late periods. So why some women can get late periods? So there can be multiple reasons. So let us start with the commonest reason which we see in our OPD, which is anovulatory cycles, which means that ovulation is not happening in time, hence your periods get delayed. So commonest cause of anovulation in today's time is polycystic ovaries. Other than polycystic ovaries, other causes which lead to anovulation can be other hormonal imbalances, including thyroid and prolactin. So let us see what is PCOD. Polycystic ovary or PCOD is a condition where there can be delayed periods and ovulation, which means failure to ovulate, and also sometimes it can be associated with very heavy menstrual bleeding or very scanty or less flow in the periods. Other symptoms of PCOD can be higher side body weight, or it can also be associated with other conditions like thyroid and high blood sugars. Getting acne or extra facial hair or hair on the chest or abdomen which are coarse and thick are also symptoms of polycystic ovary, which are known as hyperandrogenic symptoms. So there are different types of symptoms which are associated with PCOD. So how do we diagnose PCOD? We diagnose PCOD on history, examination, ultrasound scan, and also blood test. So once all these tests are done, then the diagnosis for PCOD is confirmed. Now coming to the other reasons, which are thyroid and prolactin. Sometimes if your thyroid hormone TSH levels are very high, which we call it as hypothyroidism, then you may get delayed periods or late periods. Also, if your prolactin levels are very high, which can cause delayed periods and anovulation. So we need to evaluate for anovulation properly based on ultrasound scan and hormonal evaluation, history and examination. So it is not just one test which will tell me why somebody is not ovulating or getting late periods. So it's important that you get your complete evaluation done by a fertility specialist so that you understand the reason for your late periods. Now coming to the second common cause and also very alarming for fertility, which is related to the decreasing egg reserve. If somebody is having decreased egg reserve, the periods start to come irregularly. Sometimes even they get delayed by few days initially and also can be few months. So it is important not to assume the reason for late period as pregnancy or PCOD without evaluation. So how do we know somebody is having decreasing egg reserve? We start with the history. If you have family history of your mother having early menopause, your maternal aunt having early menopause, which is before the age of 40 years, then you are also at the risk of decreasing the egg reserve earlier. Somebody who has short cycles like 20 days cycles, 21 days cycles, these women also deplete their egg reserve faster. Also, women who have undergone any surgeries on their ovaries, like removing of the ovarian cyst, sometimes even removal of a tube for ectopic pregnancy, can reduce the blood flow to the ovary and decrease the egg reserve faster. If you have some autoimmune diseases like thyroid or diabetes, SLE and rheumatoid arthritis, all these autoimmune conditions can also decrease your egg reserve faster. So if you have any such history or if you are having delayed periods, it's important that you visit a fertility specialist and get yourself evaluated for your blood test, hormonal evaluation and also ultrasound scan to know the reason for late periods. So if you are having decreased egg reserve as the cause of your late periods, it's important you plan your pregnancy earliest so that you can conceive with your own eggs. If with the decreasing egg reserve you wait for natural conceptions for too long, you may deplete your egg reserve completely and can have premature ovarian insufficiency or early menopause. So once that stage is reached, it is not possible to reverse the condition or to make the new eggs come in the ovary. So it is important that if you are having late cycles, you should get yourself evaluated at the earliest and plan according to your fertility specialist advice. So these are the reasons for getting late periods. Sometimes if you have lost too much weight or you have gained too much weight, that can also cause delayed periods, but it can also be associated with other health conditions. So it is also important, even with the weight loss or weight gain, to get yourself evaluated from a fertility specialist. Other causes for late periods can be related to ovarian cysts, which are functional cysts, and most of the patients need not worry about their periods if that is the cause for delayed period. So this is about the delayed period. I hope this was helpful. So for fertility, it is important to have regular cycles. If your cycles are irregular, then you should get yourself evaluated. What is the best treatment for fertility in couples who are more than 40 years of age? Now, there is no best treatment as such, but we have to consider the effect of age in both men and women, what it causes. So let us start with the women. As the women's age increase, especially beyond 35, their egg number and egg quality decreases significantly, which reduces your natural fertility as well as your chances with fertility treatment, including IVF and IUI. So it is important, if you are above 40 years of age, you should get yourself evaluated from a fertility specialist to understand what is your current egg reserve, what are other conditions which can affect your fertility, and what are your chances when you're trying naturally or with IUI and IVF. So it has to be an individualized treatment, and there is no single treatment which is best. But what we can tell patient is, when you are already having lower side egg reserve and you are planning a pregnancy, it's better to consider fertility treatments earlier. Because for fertility treatments also, we need the number of eggs which are good quality. So if you are planning pregnancy after 40, it's important that you move on to fertility treatment, especially like IVF, earlier, so that you can conceive with your own eggs. Also, it is important the effect of age on the egg quality, which means that the quality of the embryo which is getting formed, and also the risk of miscarriages which is related to the genetic abnormalities in the baby, which increases with higher age. So in IVF, we have genetic testing of embryos which is available, which is known as PGTA, pre-implantation genetic testing for aneuploidies, so that in couples, especially women, if they are above 40 years, if we are having enough number of good quality embryos, we can do embryo biopsy to know the genetics of the baby. If it is a euploid embryo, which means having a normal number of chromosomes, then we select that particular embryo for transfer, hence increasing the chances of implantation in a woman above 40 years and also reducing the risk of miscarriage and genetic diseases in the baby. But the problem here is, if the age of the woman is above 42 years, almost 80% embryos are genetically abnormal. So if you are beyond 40, you should move on to the fertility treatment earlier. You can consider all the options which are available, understanding the success rate of each one. If you are going for an IVF, there is always an option of IVF with PGTA if you have good quality embryos, so that we can reduce your miscarriage risk and increase your chances of implantation and a genetically normal baby. Now coming to the men's age above 40 years. Does it affect fertility? It definitely does affect, because when your age is above 40 years, most of the patients, they have some or the other metabolic problem or other health conditions like thyroid, diabetes, hypertension, high cholesterol, deranged liver function test, and all of these can affect your egg and sperm quality both, especially in men having diabetes and high cholesterol level or having history of heart disease. Such patients tend to have higher DNA fragmentation index of the sperms, which means that the DNA of the sperms is fragmented, which leads to poor quality embryo even in IVF, and also to the increased risk of miscarriages and schizophrenia and autism in children. So this needs to be addressed in time. If you are above 40 years, it is important that you do lifestyle modifications, keep your other health conditions under control, stop smoking and having alcohol, which can also affect the sperm quality. Get yourself evaluated from a fertility specialist for a semen analysis and also DNA fragmentation index. Based on your report, the fertility specialist can advise about the sperm selection techniques to use in IVF, so we can increase your chances of getting a better quality embryo and increase your chances of conceiving with your own eggs and sperms. So this was about the couple above 40 years who are trying to conceive. It is important that you visit a fertility specialist, get yourself evaluated as a couple, understand your chances, treat all the medical conditions, and there are different protocols which we use for women above 40 years based on your egg reserve and your follicle numbers. So we try to improve your chances of conceiving with your own gametes. I hope this was helpful. Thank you.